Well, I'll bet you I'm gonna be a big star. Might win an Oscar, you can't never tell. The movie's gonna make me a big star, 'cause I can play the part so well.
You're watching the C-Spine Show. I'm Dr. Craig Callewart. Please like, follow, and subscribe. Did you know that beekeeping can help with pains of arthritis, particularly neck pain and low back pain? There's pretty good medical research out there that certain types of arthritis and certain types of low back pain can be improved by bee stings, because bee venom has an effect on the immune system. And many people who are bothered by low back pain or just can't sit comfortably have what's known as sacroiliac inflammation. And the sacroiliac joint is part of the hip joint. It's right underneath the belt line. And when those joints, which are part of the hip, become inflamed, it's very uncomfortable. A portion of the population that's affected with this sacroiliac pain is actually dealing with an autoimmune disease. Common examples are thyroiditis, where they're having a thyroid problem, rheumatoid arthritis, lupus, psoriasis, gout, pseudo-gout, even certain immune problems that occur from a viral illness, sore throat, bronchitis, cough, ear infection like I have right now, can all trigger an autoimmune body response that causes the joints to stiffen up and hurt, and yet bee stings will reduce that kind of pain. I've been a beekeeper since high school, off and on. Certain types of my life I just haven't had the time, like in medical school or in training or early in my family life. But now I have the time, and now I probably have 3 million honeybees. And my next door neighbor wants me to allow her daughter to get stung so that she can get off some of the rheumatoid arthritis medicines that she's on. One of the problems with that is a certain percentage of people will then develop a fatal reaction to bee stings and die. But either way, the pain goes away. But there is pretty good medical research that those people will be improved because it modulates or lowers the immune response. During the spring season is the most important time about what we call the apiary. That is where we keep bees. We keep bees in boxes that are roughly 10 inches high and roughly 1 foot square. And in those boxes will be anywhere from 10,000 to about 30 or 40,000 bees. And the number of boxes in my apiary will go from 20, 25 boxes to about 70 boxes. So I'm going from 500,000 bees to 3 or 4 million bees during what we call the spring buildup, from February to right now, May. The idea being is to put as many bees out in the field as possible during May and June, when the nectar producing plants and nectar producing trees are in full bloom. And that in return causes the bees to gather the nectar, bring it into the hive, add enzymes to that nectar, which convert it to the sweet honey we eat, and then dehydrate that honey by, I think, about 90%. Then in turn, they cap it and store it. And then I come around sometime in July and harvest it. Many beekeepers have neck and back pain. And on my website, you can see examples of proper lifting of beehives because these boxes weigh anywhere from 30 to 60 pounds. And one of the techniques in lifting is to try to keep the box as possible, close as possible to the body, and slide it up the leg or down the leg if you're lowering it, so that not all of the weight is on the low back and not all the weight is pulling on the neck, because that can rupture discs in the neck. It can rupture discs in the low back. And that's one of the techniques I try to teach other beekeepers, and I've also put on my website, but we'll more broadly apply it to saying people who are doing bending, lifting, pushing, pulling, and twisting, make use of accessories like arms or legs or tables or whatnot, so you don't do the full weight lift. But I think one of the most interesting things is the mating season, because the life cycle of a bee during this time of year is fairly short. It's about 6 weeks. That's just because the bees are working very hard all day long, both collecting the nectar, dehydrating it, maintaining the temperature of the hive at 92 degrees. But the queen has to repopulate the hive, and she lays up to 2,000 eggs a day for her lifespan, which can go up to 2 years. What's really most interesting about this is she has one opportunity to mate, although with multiple partners. And this occurs after she hatches at 12 days. Basically, the next day, day 13, she goes on her mating flight. And this mating flight is again once in her lifetime, and she flies up above the hive to an altitude of around 30 feet. And during this time, there are a bunch of male bees flying around known as drones, and they encounter the queen, and they encounter her many times. And these are drones from many different beehives. And this then brings in the genetic diversity. And so she can be mated 12 or 15 times. And then she comes back down into her hive and she stays there for the rest of her life. But somehow or another, she stores enough genetic material to lay up to 2,000 eggs a day for the next 2 years. Fascinating stuff with bees. And it's sort of like some of the fascinating things we do in surgery. One of those would be blood clotting. And I remember my father telling me when he was in medical school that he learned there were about 30 steps to blood clotting. Last time I checked, there's 5,000 known steps to blood clotting. And so also a very complex process that we're just now understanding, but it's still something I have to deal with every day, is making sure the blood clots properly after the surgery so that there's the healing we want without too much blood clotting, leading to things like pulmonary embolus or heart attack or stroke. One of the things I like about what I do in my calling, and it really is a calling as much as it is a career, is helping people out of difficult situations. And right or wrong, I take care of a cadre of single mothers. And in order to maximize the time they can be with their children, they work long shifts, long hours, doing warehouse work, which is physically demanding. 30 to 50 pounds of lifting repetitively during their 12-hour shifts. That allows them to earn the income they need to support their family, but it really is tearing up their bodies. The first thing I tell them usually is, look, you've either got to change what you do, how you use your back, or I have to go in surgically and change your anatomy. And so if it's all possible, see if you can find work making that kind of money without me having to go in and do the surgical repair. And sometimes the problem is just too far advanced that they're going to need the surgical care anyway. But recently I've had several successes that are gratifying to me because I'm able to repair them. They go through the appropriate physical therapy and core strengthening, and then they return to their work, being able to reach overhead, pull things from overhead. Their neck pain is a whole lot better, or being able to lift things from the floor, and their low back pain is a whole lot better. And that's the reason get out of bed every day and bring the office staff together, and the reason they come to work every day to try to help people do what they need to do.
You're watching the C-Spine Show. I'm Dr. Craig Callewart. Please like, follow, and subscribe.
Well, I'll bet you I'm gonna be a big star. Might win an Oscar, you can't never tell. And movie's gonna make me a big star, 'cause I can play the part.